To have to share the information with my employer that I had cancer is possibly one of the hardest things I've had to do, because you're stunned. I've never been tasered, but possibly tasered comes to mind. You can't function. You don't know where to put it yourself. I feel I've let the company down because I was evaluating processes and systems, and those processes and systems have carried on without me. They've changed without my input. There are others, obviously, that can give valuable input, but you just feel that you're no longer part of a team. It's that sense of belonging that we all enjoy. It's completely taken away. So instead you belong to this cancer club and you've lost, well, in my case, I've lost my value system.
Don't think they know much about mental health. My physical health, they know I struggle a bit with it, but they don't know how much. In general, I'll just say, I'm in a bit of pain today. Is there any chance one of you can go and put the crates on the bench and I'll do the fridge? Most of them are all right about it, and they'll do it.
I do full-time jobs, and after 9 months a year, I just collapse. But the problem is, if you don't work full-time, you don't have money or enough money to survive. Went during lockdown because it turned out that I did my accounts and 52% of my income was PAYE last year, but all on 0-hour contracts, so I didn't get furloughed, but I also had too much PAYE to get any money for being self-employed. So I was one of those people that fell through the gaps. And I think that's the biggest problem with things like 0-hour contracts, that you do fall through the gaps of employment.
Returning to work was really difficult after cancer treatment. Emotionally, I was more fragile. And I hadn't anticipated that when I went back to work. It sent me into quite a downward spiral, really. I was finding work really hard. Part of me thought, if I don't get back, I'm not going to get back. And then, of course, in the back of my mind as well, I'd had nearly 10 months off. And if I couldn't give my employer a date to go back, then although nobody ever said to me, we were going to end your contract, that is a possibility. When I went back, I had a long think about what it was that would help me. So at the moment, I've got longer appointment times. I've been allowed to reduce my hours, so I'm only working 2 days a week at the moment, and that's really helped me. I've got some lymphedema in my arm, so I just have to be aware of having a soft touch keyboard helps, and a headset when I'm on the phone, so I'm not sitting with my arm bent because I've got a sleeve on it. So those kind of practical things were done.
If I'd have said to somebody, I'm recovering from chronic fatigue, I don't think they'd have given me the job. So I sort of drop in little bits about managing my energy, but I haven't come out full blown and say, I've got this condition, because people don't understand. You see what I mean? And I do feel embarrassed in a way. I didn't tell them up front, but I just thought I would not have got the job. And I knew I could do the job, and I knew it wouldn't impact on it because it's only 10 to 15 hours a week, and I've got the flexibility to do that however I want.
I'm getting on now, and I just don't feel like launching into some career. I don't think I could cope with it anyway with my anxiety. Just doing a few little cleaning jobs is cool with me. But it's a shame because I think I had an awful lot of potential that was ruined by anxiety.